Dear colleagues and friends, I'm honored to have the opportunity to address you today. The COVID-19 pandemic has upended our health systems, our societies, and our economies. If there ever was a time when we truly needed to step up the progress for women's leadership in global health, this is it. Women make up over 70% of the world's health workforce, but men continue to dominate leadership roles in global health. We must tackle the issues that prevent women's equal participation, such as women's burden of care and domestic responsibilities, wage gaps, education and literacy, and autonomous decision making. These gender-related barriers also impede the achievement of universal health coverage and will likely impact the equitable deployment of COVID-19 therapeutics and vaccines under development. The initial supply of any vaccines will be limited, which is why it's all the more important that they be given to those most at risk in all countries, rather than to all people in some countries. Confronted with this challenge, the European Commission, France, Germany, WHO, and partners started the Access to COVID-19 Tools Accelerator to speed up the development and equitable distribution of vaccines, diagnostics, and therapeutics. As part of the ACT Accelerator, WHO and partners joined with Gavi and CEPI to establish the COVAX facility. Its aim is the production and equitable distribution of 2 billion vaccine doses by the end of next year. 186 countries and economies have now joined and will benefit from the COVAX facility. Even as we race to develop a vaccine for this virus, we must resolve to make better use of vaccines we have. Currently, we have effective vaccines for polio, measles, meningitis, pneumonia, diphtheria, pertussis, cervical cancer, and more. And yet, these diseases continue to kill. In the end, vaccines are only as effective as the health systems in which they are delivered. Increasing women's meaningful participation at all levels of the health system is imperative for delivering equality and better health outcomes for all. I thank you.